All right, hi. Thanks for coming out to this here today. We thought we would do some of these community talks and address things that are really common. And GERD is one of the more common problems that a lot of people have related to their GI tract. GERD, we more commonly just call heartburn. GERD is an acronym for gastroesophageal reflux disease. It's just easier to call it heartburn. So gastroesophageal reflux disease, or heartburn, it means when stomach contents are inappropriately refluxing or going backwards back up into the esophagus. There's a little bit of this that happens just all the time in everybody, but it's when it is at an inappropriate amount that it can cause problems. Heartburn is it's the symptom that we feel. So GERD is the gastroesophageal reflux disease is what happens, and heartburn is how patients describe it and how patients feel that pain, which is typically kind of a burning sensation down at the bottom part of the rib cage. So just to go over some basic anatomy, we have the esophagus, which is just a tube that takes food from the throat and puts it down into the stomach. And then you have the diaphragm, which is your main breathing muscle. And that diaphragm is what differentiates things in the chest from things down in the abdomen. There's a little hole in the diaphragm to allow the esophagus to connect into the stomach, which is down in the abdomen. And there's a lot of mechanisms that the body has to help prevent things from going back up that way. When this doesn't work very well, it makes it easier for things to reflux back up, and then we get heartburn. So there are many things that cause heartburn. We've seen this in general that as people gain weight, heartburn becomes more common, and that has to do with abdominal pressure and where that weight sits and how it interacts with the stomach. It can actually push contents back up into the esophagus. A hiatal hernia, a lot of you probably have heard of these. They're really common as we get older. A hiatal hernia is where the stomach kind of moves its way up above the diaphragm. This part just kind of sneaks its way up in here, and that distorts that barrier, so people are a lot more prone to getting heartburn from when they have a hiatal hernia. Medications can also relax some of those muscles there, and then if they're not doing their job, then much more heartburn. And then we see it as we get older, just in general, and that probably has to do with every breath you take actually pulls the stomach up a little bit. And so over time, it can actually help create these hiatal hernias that can then help cause reflux. So just briefly, the medications, there's a lot of medications that are associated with heartburn. These are the main ones. Osteoporosis, particularly a medication called alendronate. Antibiotic medications like tetracycline will also relax that lower esophageal sphincter. Heart medications like nitroglycerin or Nitrobid. Some people are on these to help keep the blood vessels in the heart open. Those also relax the muscle, the lower esophageal sphincter, and then people are more prone to getting heartburn. Overactive bladder medications like oxybutynin works very similarly to how nitroglycerin works, and it just helps relax that sphincter, and then reflux more likely to happen. Any narcotic-based pain medications like Lortab, Percocet, hydrocodone, oxycodone are also associated with these. Anti-anxiety medications, Ativan and Valium, and then erectile dysfunction medications like Viagra and Cialis also relax this muscle here, and people get heartburn. So we already talked a little bit about a hiatal hernia, but I want to just put it up as a picture here. So this is part of the stomach that it's worked its way above the diaphragm and is sitting up in the chest. You may have heard of a couple different types of these, like a sliding hiatal hernia. That's one where it kind of moves back and forth every time you take a breath. There are large hiatal hernias where a large part of the stomach moves up here. There are small hiatal hernias where only a small portion moves up there. But what it does is you can see that it distorts the ability for this part of the body to keep acid and other stomach contents down here and not going up that way. So food, I mean, we eat food all the time. It goes through the esophagus. That doesn't cause us heartburn. So for food to come back up into the esophagus, it's not a big deal. But there's something very different about the stomach. Your stomach makes a series of digestive enzymes. These help break down the food, and those can be irritating to the esophagus. But the main one is acid. Your stomach makes a lot of acid. That acid is there to kill off bacteria and viruses in the stomach. But when it inappropriately gets up into the esophagus, it causes that burning sensation that we can feel. Acid, it does help absorb some nutrients, but the main reason we have acid in our stomach is basically to sterilize our food. Fortunately, with modern refrigeration, our food supply has gotten pretty safe, so we've kind of outgrown the need to have stomach acid. And that is what we'll get into a little bit later about some of the therapies for reflux. So for people that have a lot of reflux and a lot of heartburn, there are lots of people who don't go see a doctor about it and they just live with it. In some cases, that can cause a lot of tissue damage and destruction in the esophagus. And that's what this picture here is showing. This is something called reflux esophagitis, meaning that the acid reflux is coming up and is actually destroying the tissue in the esophagus. That's a pretty bad case of it. Over time, if nothing were done, it can turn into this. This is a stricture or a narrowing. Basically, all the healing that the body tries to do here results in scar tissue, and the esophagus gets smaller and smaller and smaller right at the very bottom of the esophagus.
Can they call ulcers?
Yes. So these are ulcers.
Oh.
Yeah. Another name for the esophagitis, yeah, just an ulcerated esophagus. And then as those ulcers heal, it leads to this scar tissue. So some people will see me and food is getting stuck, and we go down there and we find this, and they've had heartburn for many, many years that either didn't bother them or they just never sought medical care until it became a problem. Another complication of heartburn is something called Barrett's esophagus. Some of you may have heard about this. This is a condition where the esophagus changes to try and protect itself from all the acid. But in the process of changing and protecting itself, it causes some damage to the DNA there. And that's what Barrett's esophagus is. And when you damage your DNA, you're much more prone to getting cancer of the esophagus. So this is a condition where reflux actually can lead to cancer in the esophagus. The tissue just starts looking different. That's how we tell when we go down there and look at it. Not everybody who has Barrett's esophagus, this precancerous condition, will even realize that they're having heartburn. So it makes it kind of tricky to find the right people to check for this. Now, Barrett's esophagus, once somebody has this, because of poorly controlled heartburn, their risk of developing esophageal cancer goes up by 50 times compared to somebody who does not have esophageal or Barrett's esophagus. This is one of the fastest increasing cancers in the U.S. We see that just because reflux is becoming much more common. So esophageal cancer, as a consequence of more common reflux, is also becoming more common. Still overall not a very common cancer to develop. So when I say, hey, this is 50 times more likely, you have to remember it's 50 times more likely than very, very, very unlikely. But it is greatly increased. And when we identify people who have this condition, we watch them closely with repeated upper endoscopies to make sure that nothing is heading towards cancer, and if it is, then we treat it. This is oh, yes?
So why now is it more likely to get that, you're saying it's increased nowadays? Is it because of food processing or chemicals?
It's always hard to really know for sure, but we think in part it's because, in general, if you looked at what are the main causes of reflux, in the United States, on average, with the baby boomers getting older, it's a slightly older population. So cancer's in general actually on the rise. But the other thing is with increasing obesity in the U.S., you see a lot more just reflux. And so it's kind of a numbers game that with more reflux, we're seeing more esophageal cancers. Now, whether or not additives in food, preservatives and things like that play a role in it, it's not known at this time that that's the case, but we certainly have added a lot more things to our food over the last 50 years, and that would correlate with the rise in esophageal cancer, but we're not sure. And it's a hard thing. It's always very difficult to prove those things, but people they are looking into that. This is a picture of esophageal cancer. Just doesn't look good. These are very dangerous. They're very difficult to treat cancers as well. So we do everything we can to try and prevent this from happening. So anyway, that's all the bad news. Let's talk about the good news. Yes?
So obesity plays a big role in this, I know you said. So if someone had acid reflux and they lost weight, would it improve possibly?
It would improve their reflux and decrease their chances of developing any of these complications. Yeah, we see people who are able to come off their medications with weight loss. So the problem is weight loss is really hard to do. Yes?
So like if you've been taking something like I take the bone medication and you quit, then can you no longer have reflux, or are you just in for life?
If the medication is making your reflux worse, and you were to quit the bone medication, then your reflux may get better and you would not need any medication for the reflux. Yes. But then what are you doing about the bones?
Well,
Yeah.
I'm just on the shots now and that doesn't cause it. That's why I'm wondering if I can go off now.
The other medication. You certainly wouldn't hurt to try. And we'll talk about what to do with those medications. They're very friendly medications, meaning that you can stop them, start them, and kind of take breaks from them from time to time to see if you need to be on those medications. Because really, we should be trying to be on as few medications as we possibly can. So, you mentioned this, sir, treatment of reflux and heartburn. The non-medical thing, weight loss. Like we were talking about, it's easier said than done. But it has been shown to be very effective in those that are able to do it. Eating food before you go to bed. That's another big one. We like to suggest that people wait at least a couple of hours before they go to bed. Well, between when they eat last and when they go to bed. And that's because if you eat a lot of food and then you go to bed, your stomach is just filled with food, and you lie down so you don't have gravity keeping all that stuff in the stomach. It's just more prone to leak up into the esophagus. Some people report that spicy foods or fatty foods can make their heartburn worse. This is very similar to how medications work. They kind of relax a certain naturally occurring chemicals in our foods will relax that lower esophageal sphincter, and then people are just more prone to heartburn. And some people will put bricks under the head of their bed and elevate the bed slightly just so gravity kind of works for them while they're sleeping. Yeah, and then you have to talk to your partner who's sleeping with you, whether they want to be in a bed like that. Yeah, so not everybody's happy with that suggestion, but it is one that can be done to avoid medications to deal with more mild symptoms, really. So now the medications, and this is what most people get on because they're very safe. They're not perfect, but they're very safe, and they're very effective, and that's the main reason. There are three types of medications out there. One are just medications that neutralize acid. Your stomach is always making more acid, so these are very temporary fixes. They usually work for about 30 minutes. They're great for people who normally can control their heartburn, except when they go out for an Italian meal or something like that. And then they get the heartburn from that. Tums, Rolaids, very good just to temporarily neutralize the acid that's inappropriately coming up into the esophagus. The first major medications that came out are these medications called the histidine 2 blockers, and that just has to do with biochemically how they work. But we know them mostly as Zantac and Pepcid. These medications have been around pretty much since the 70s. Very safe medication, very effective too at controlling acid levels. They block a signal that tells your stomach to make more acid. So the stomach never gets that signal and it makes a lot less acid. Some people report though, if they use them on a regular basis for many months, that it becomes less effective over time. And that's kind of the problem with them. But they're still very, very good medications and very safe.
How often do they take those?
Most people, it's about every 12 hours. It seems that's how frequently you need to do it to keep the acid levels low enough. Some people will use this just once a week, or kind of like when they use the neutralizing medications, just as needed.
Can you combine those two, the Tums and the Zantac?
Yes, you can. Yeah, very effective combination. And some companies actually will sell them as combination medications. And then the one that a lot of people probably know about are these ones called the proton pump inhibitors. The proton pump is a fancy name for the part of the stomach that makes the acid. So these medications tell the stomach no more acid, at least temporarily. The first one that came out was Prilosec. A lot of you probably have already heard of that one. And then there were several other medications like Nexium and Prevacid that came out that are very similar to how they work. These, generally, for most people, you can take them forever and they're not going to lose their benefit, unlike some people who will lose benefit with Zantacs and Pepcids out there. So a lot of people, when we start them on these, they tend to stay on them for a very long time. These also tend to be a little bit more effective at decreasing the acid, so most people are only taking them once a day rather than twice a day, like the Zantac and the Pepcid. But there are lots of people who also will take these twice a day as well. Yes?
So, my doctor told me I could take the Prevacid in the morning and then like maybe around 5 take Zantac.
Yeah. So that's a combination. We're not sure if it's any better to just being on Prevacid once a day or twice a day, but it has the benefit of having you take less of the medications. You're kind of splitting it out so you're not getting so much of one medication. There's nothing wrong with doing that. It's a very, yeah, a lot of people get more of their heartburn at night, and so the Zantac and Pepcids taken in the evening tend to give it a little boost just to control the acid at that time. And the Prilosec, Prevacid, Nexium can be combined with the Tums and the Rolaids. And then, like you say, you'll see a lot of physicians recommending combination of this in the morning and this at night. But if you can just get away with just as little medication as possible, then that would be the ideal. Yes?
I was on Nexium and it was controlling my stomach acid wonderfully, and then my insurance discontinued.
Yeah, so these three that I wrote here, there's more than this, but these three are the ones that you can buy over the counter at the grocery store and at the pharmacy. A lot of insurances stopped covering them when they became over-the-counter medications. And that was unfortunate.
Yeah, they were going to charge $5 a pill for it.
Oh, gosh, yeah. I tell a lot of people in those situations, you just go get Prilosec or Nexium over at, you can, Costco is a cheap, good price for it. Online, you can find it online too.
But they're only 20 milligrams, and I was taking 40.
Yeah, your insurance didn't work with you very well on that one.
Is there a problem with these with memory loss?
Next slide. Yeah, you saw my slide. So there have been some studies. So Prilosec was the first of those proton pump inhibitor medications. It came out in the 90s. So we have 25 years of experience with Prilosec. People started wondering, well, hey, is this a safe medication? Because there are a lot of people on these medications, and they've been taking them for 25 years. So they started looking at these patients who had been on these medications for that long. And they found that there were some increased risks compared to people who were not on these medications. That included memory issues like early dementia, osteoporosis, heart disease, and kidney disease. This is a somewhat controversial thing because the way that these studies were designed, and it was the best that we could do, but these don't prove that the Prilosec is the cause of all of these. It just suggests that that may be a factor. And every time they do a study, it comes to a different conclusion. Not all the studies are saying, hey, every study we do is always saying there's an increased risk of heart disease. One study showed heart disease. Another study did not show heart disease, but showed dementia. Another study didn't show dementia or heart disease, but showed osteoporosis. So it's it's really hard to kind of see exactly what the main risk of these medications are. We still think they're very safe, but that's why I say you take as little of this stuff as you possibly can to get the job done. So this one you'll see, about 3 or 4 years ago, a lot of information started coming out, news reports, that these medications were not safe. There's kind of a question as to what those studies even mean and how to interpret them correctly. In my opinion, you just have to weigh out the risks and the benefits of the medication. If the medication is very clearly effective, like Nexium was for you, it's probably worth the risk if there's any real problem here, because the findings that they found here is very small increases, so it's hard to tell that. But I would never want any patient to be on these medications if it were not effective or if I had a better option available. So it just has to be weighed out. The third treatment, so we talked about non-medical treatments like weight loss and elevating the bed. We talked about the medicines and some of their controversies. The third treatment available is something called anti-reflux surgery, and there's a couple different versions of this surgery. This is one called a Nissen fundoplication, and what they're doing is they're taking part of the stomach and wrapping it around the esophagus, kind of tightening up that barrier. When people have a hiatal hernia, they also pull the hiatal hernia back down into the abdomen and then do this, so it corrects the hiatal hernia as well. It's a very effective therapy. We usually use this in people who, the medications are not a good idea for them to be on for various reasons, or for people that don't respond to the medications. Because those medications, the only thing they do is make less acid. They don't prevent anything from going up into the esophagus, just makes it so it doesn't hurt. This actually makes it so things don't reflux back up there. It doesn't work in everybody, and surgery is a potentially dangerous thing, and so that's where you get into that risk and benefit aspect of what we decide to do with people with really bad heartburn. Yes?
And I've heard with this surgery, you're not able to regurgitate if you have to. Is that true?
It's a lot harder because you've now created this fixed narrowing here, where before this could relax if you needed to vomit or something like that. But when this is fixed, it is a lot harder. Yeah, so once again, there's a trade-off that comes with these things. So we do send a lot of people for surgery, but the vast majority of patients, we try to get by with non-medical therapy, and if that doesn't work, medical therapy. And we tend to use this as sort of, well, if the medicines don't work or wouldn't be a good idea. So as a gastroenterologist, I do a lot of the esophageal stuff for my group. So we always are on the lookout for Barrett's esophagus. When we get a patient in that we feel has a high risk for that, we offer them screening, and that involves taking a tube with a camera and a light on the end of it and go endoscopy. A lot of people also develop difficulty with swallowing related to their heartburn. I actually, the patient I just saw right before this had heartburn that was causing him to have food get stuck. So we'll get that fixed. That one's easy. Pre-surgical evaluations, people that would like to proceed with the anti-reflux surgery. There are some steps that have to be done to make sure that they are good candidates for surgery, and we're doing it in the right people. And then we also see people in the office just for heartburn evaluation and basically to have this talk with them that you and I are having here today. So yeah, thank you for joining us. We're just right there, so that's our building. We're in that building right there, right across the parking lot.
Oh, that's it.
Yeah, that's us. And we gave you a packet that has a couple of different information pages that our office has created on heartburn, on colon cancer screenings because it is March, on what upper endoscopy is. So yeah, thank you for coming out. Yeah, any questions?
The white bread can ferment it.
It can. It can absorb some of the acid, but it also may stimulate your stomach to start moving things through when you eat a little bit, and that moves the acid out of the stomach. So as long as it's a small amount of white bread and it works for you, that's fantastic. Some people, there's a lot of variability as to when people get it. The majority of times where I see people complain about their heartburn is after a meal, like immediately after a meal. But I have had patients complain of chest pain in between meals. Sometimes that is heartburn. There can be other things that can cause that same sensation that aren't related to acid. That's a great question I didn't get into on those. So it's taking it a good 30 minutes before. The medication is activated by eating. And so taking it 30 minutes before kind of gives it a little extra oomph. It shuts off more of the acid pumps in the stomach when you do it that way. Taking it in between meals or not related to a meal, it still is effective. So we would want you to do it. We'd rather have you take the medication than miss the medication, but it won't be as effective. You won't find it to be as effective as if you take it with food.
So you do need to eat something after you take it?
It's better to eat something after you take it. It's still effective even if you don't. It's just you're going to get a little bit more bang for your buck out of it if you do.
What about taking it right after your lunch or dinner, which is a big meal, not just a little bit?
Yeah, it's best if taken before. Yeah, but that's just where you get more efficacy out of the medication. Yes, actually, that one's a little complicated, but chocolate, red wine, caffeine, these are other things that also people report worsening their heartburn. Taking that with food delays the absorption of those of the chemicals that are in those foods that relate to the heartburn. So yes, in some patients that actually helps to do those things with. For other people, it may actually delay how long those naturally occurring chemicals get out of the body. So it's very individual. But yeah, trial and error is all we can do for that. Yes, ma'am. Different set of side effects, but Zantac was not associated with those early dementia, heart disease ones. So right now, a lot of people are trying to get people off of Prilosec and Prevacid and over to Zantac and Pepcid. And that's a great idea for those that it works in. But it doesn't work in everybody. Some people just have to be on Prevacid. Some people just have to be on Prilosec because they are more effective medications. It tends to be more common as we get older, but the guy I was just seeing, he was in his early 20s. And I see teenagers for this as well.
I guess depending on the kind of junk food they eat.
Yeah, the anatomy, and there's a lot of things that go into it. That's the one that a lot of people think may be probably the most likely one to be true. It does inhibit absorption of calcium a little bit. So a lot of people will take a calcium supplement while they're on these medications. There's never been anything to show that that is beneficial, but there's no harm in doing so. What we just tell most people is make sure if you're on this medication that you get age-appropriate checks for osteoporosis. But we don't, it doesn't mean that you need to be on osteoporosis medications if you're on these medications, but people that are on these medications may be more likely to develop osteoporosis.
If you already have it,
It's not going to, as far as we know, it's not going to make things worse, and you're probably already taking a calcium supplement anyway. So, yeah, you're doing the right stuff. It shouldn't make that much of a difference as far as when you take it, as long as you're taking it on a regular basis. Your body can only absorb a small amount of that calcium that's in that pill. So as long as you're kind of regularly doing it, your body will pull the calcium out that it needs. But as far as doing it at night or the morning, shouldn't make that big of a difference as long as you're very routine about taking it. Okay. Any other questions? These are great questions, guys. I love it. Yes? Yeah, so diet will have a significant influence, and that goes back to that spicy food, fatty food, the alcohol, caffeine. Yeah, it just does stuff. Oh, yeah, and there's a lot of variability between patients as to what sets off their heartburn and what doesn't, which makes it very difficult for us when we say, hey, avoid these foods, because that doesn't always work for everybody. But it is all about just identifying the things that make it worse. Yeah, the vast majority of people with heartburn, it just causes a symptom. It doesn't lead to reflux esophagitis, those ulcers, or to cancer or anything like that. That's kind of a very small percentage of people with heartburn will develop those really bad complications. So the majority of what we're trying to do is just control symptoms for quality of life. There's no study. Every country will routinely kind of survey people for what rates of heartburn they experience, but not everybody it describes heartburn the same between the countries. So there's not really a good study to show that there's one part of the world that tends to have more heartburn than another. In the US, though, our esophageal cancer rates are on par or a little bit above kind of the global average, but there are places like in Asia that have much higher rates of esophageal cancer than we do. We think that is partially related to diet, but we're not exactly sure. Yeah, and we're not sure if it's so related to spicy foods, but yeah, it does hurt when you already have heartburn. Yes? Yeah, so that gets into a kind of a complicated part about some people will just, a little bit of acid won't irritate some people, but that same amount of acid will irritate other people. And so genetics, does tend to run in families that some people are more sensitive to what they experience in the esophagus. We also find that hiatal hernias tend to run in families. We're not exactly sure why that occurs. And a lot of it is probably related to that. All right.
Well, thank you very much.
Well, thank you guys for coming. It's been great.